This morning, I had a great breakfast with a couple of the individuals from the Northeast Valley Managed Care Department, including their COO. And the conversation was great. We had a pretty organic conversation regarding what it's been like as they've journeyed into expanding their focus on Medicare Advantage growth. So, a lot of great takeaways there in terms of the overall climate and where other peer health centers are going or not going as far as Medicare growth goes. What was shared was some interesting notions from health center peers. And one is that there is still some trepidation when it comes to expanding Medicare Advantage. And some of the reasons that were shared were that Medicare Advantage or Medicare patients in general take up a lot of extra. There's a lot of extra services that they need, a lot of extra care, whether it's case management or just navigational support. And because that's not a billable service and that takes up a lot of operational need, there is some hesitation. So that's one. Regarding the stigma about working with a broker for those health centers that do want to participate in Medicare Advantage growth, there is still some hesitation there due to the fact that there are some misconceptions when it comes to brokers. Some are actually valid, but for the most part, there is some hesitancy because the stigma around brokers are going to take my patients or brokers are going to lie to my patients. And so, as part of the work we do like to really sit down with the FQHCs to help them understand how we, Elcar Health, work with brokers, really standardize processes, expectations, and workflows to ensure that there is transparency and there is trust. So that's another one. And then I would say the third takeaway was some along the lines again around Medicare and brokers and a misconception that is pretty common, which is why can't our staff enroll? Why can't our staff assist our Medicare patients in enrolling in Medicare Advantage plans? And so, as you know, you do need to be licensed and in order to assist and enroll a beneficiary. And there cannot be a conflict of interest. So a health center employee, whether they are licensed or not, cannot actively utilize their license in that way. So that would be the third takeaway. So I love listening to objections and hesitations and misconceptions because it just allows us to really lean into what we focus on day in and day out when it comes to working with health centers on their Medicare program. I did have the benefit of touring the San Fernando site. The San Fernando site is a beautiful campus. I wish I had a picture right now to share, but there's this wonderful walkway that just highlights tour. When you start, you're just walking on the campus. There's a nice frame. I don't know if I have a picture I can share, but nonetheless, I'll post it on LinkedIn. It was really cute. The tour itself was great. We were able to walk through and visit the pediatric suite. It was fully the waiting area was pretty packed. Highlight there was we did see some messaging for patients that need Medicare assistance. Even in the pediatric suite, that's always a plus because, as you know, there are multi-generational households that go to the doctor's office together. There may be grandmothers that are taking their, or grandfathers taking their grandchildren into see their pediatrician. And so it's just wonderful to really have that information throughout the health center. And I did notice it in other suites as well. There's a women's wellness suite dedicated completely to women's health, which is amazing. And it is a two-story suite. It's fully functional with an elevator. So for those individuals that require a little bit more assistance in that way, that was also nice to see. There's an on-site pharmacy. There's an on-site lab, radiology. So it's a one-stop shop. And I think that was just a nice selling point. Pretty ample parking, free parking, and it's centrally located. So that was also nice for individuals that need to take public transportation as well. Some notes from the tour itself, just seeing the patients walking, across campus to their appointments, there was just a sense of pride. You could see that there was a lot of appreciation for the services that they are receiving, a lot of multi-generational mother-daughters at the appointments together. So that was really nice. I appreciated just the time and the energy that was allowed us as we visited, and just grateful to the opportunity and sitting down with our friends. Today was a good day just to appreciate them as partners and just to really talk about how far we've come in their journey as they've expanded their Medicare Advantage focus. And this year is going to be even better. We are planning for the full year and just looking at other ways that we can come out into the community as well and share the story of Northeast Valley. Great day. Thank you again to our friends at Northeast Valley, and we look forward to another successful year. I really appreciated the fact that it instilled a lot of, I would say, gratitude for the work that the health center teams do. And it restored, I think, just the mission in meeting patients where they're at, meeting health centers where they're at. Not everybody is ready to turn on the growth faucet when it comes to Medicare. Not everybody has, the capacity to do that. And so really listening to not just what Northeast Valley shared about their own journey, but really listening to what their peer health centers are saying. And that allows us to really reinforce our message to them and being that partner in terms of helping them, with the correct information, dispelling myths, and continuing to really just champion the health center journeys of their patients as well as the teams that we work with. I would just say that the last thing that is on the minds of our health center partners is really enhancing patient experience. And that, again, I think is music to our ears, because at All Car Health, we are bringing more solutions. We are bringing in more partners and just different innovations that will allow for that to meet the mission of the health centers, which is to enhance patient experience, to stay connected to their patients, and to really reinforce their mission and their objectives in caring for all patients.